It's a great pleasure to be here today, so I'll simply add my thanks to those of the other speakers, to the people from the good people from the HRB who organized today's conference. So I think this presentation follows on quite nicely from some of the themes that were introduced by Sarah Morton earlier and by Paul Reed, and it goes in the direction of moving from strategies and principles towards what does the evidence show, how can we intervene, and what are the different logics of intervention that can be adopted when tackling drug-related harms. So this is the result of a study which was funded by the HRB. It's based on a systematic review of the literature, perhaps a little broader than a systematic review, let's say an evidence review, embracing qualitative research, embracing grey literature on this theme. And it's tackling the question of place-based initiatives. So I'm sure you're all aware, probably much better and much more aware than I was at the beginning of the study of the intricacies of this type of initiative. But anyway, I'll aim to provide an overview of the different kinds of initiatives that are out there, and summarize the research on their impacts and their potential, and where the state of the art is going and moving in terms of this type of initiative. So this is the structure of the presentation, a little bit of context, and then we'll go through the concepts and what has been done already. So the research was carried out just over the last year or so. And I think it's useful to start by sort of saying what place-based initiatives aren't. I mean, they've definitely emerged as a paradigm, an alternative paradigm, which aim to address some of the shortcomings that are perceived in other kinds of initiatives. So the place-based approach is often seen as promising, where other strategies, perhaps top-down, centralized government programs, have been seen to be less effective. And the ultimate goal, obviously, of the research and of the presentation today is to contribute to ongoing debates in Ireland about different ways of addressing drug-related harms. So what we're dealing with is a particular kind of initiative which follows a logic of community involvement, integration, interagency working, multidimensionality, and a plethora of different terms have been used to describe these initiatives, going from place-based to coalition-based, community-wide, from the cradle to the career. There are all sorts of terms used to define initiatives which take place seriously. Now, what does that mean? I think for a number of years before place-based initiatives really took form, some of the principles that are driving this innovation were already quite well established, starting, for example, with the principle of user involvement. So at a previous drugs forum, we discussed user involvement more directly, but that's again a theme here within the place-based initiatives literature. So it is seen as developing from socio-ecological approach, so that was mentioned earlier, the bioecological or socio-ecological model, which views behavior as being influenced in important ways by the context. So key theme in place-based initiatives is collective impact, so to produce impacts in the context and the environment in which people live out their lives and make their decisions in order to influence those outcomes. Another principle, obviously, is around targeting, the idea of spatial targeting. And as it turns out, place-based initiatives really don't have a strong element of geographical targeting. So when we're talking about place in the context of place-based initiatives, it's more about community, about the place as a community and a social space where the different aspects of drug-related harms can be tackled together And this is again picking up some of the themes that were mentioned earlier this morning. Place-based initiatives also build on probably 30 years of research on the different ways in which the context and the local neighborhood can influence outcomes. And there's a growing awareness of how complex and interlinked and recalcitrant social problems can be at local level. The whole idea of wicked problems, which are so embedded in interactions and interlocking mechanisms that they can be particularly difficult to address through straightforward intervention. So the idea is that the place-based initiative is a kind of a powerful tool that can be used to address particularly difficult problems. And like in the modern version of this approach, it's about systems level thinking. You know, the response has to be just as far-reaching and broadly based as the problem itself. So fitting the policy and practice response to the nature of the problem itself. And in that context, the community and the place is the area or the theatre within which those different complexities and elements and facets of the social problem can be addressed simultaneously. So it's seen as facilitating not only the involvement of local communities and local people, but also this kind of multi-stranded approach. So what research has already been done on this theme? We identified 4 literature reviews, which you can see on the slides. The one which is perhaps nearest to our own review is Stockings et al. From 2018, Whole of Community Interventions and so on. But really across these 4 reviews, there isn't a whole lot of overlap between the publications that are cited in these 4 reviews and the publications that we identified. And there are a number of reasons for that. But just before proceeding, I'll just summarize quickly what the reviews say. They say that rather than focusing on individual level behavior, place-based interventions look at the context. So they try to identify an arena in which interventions can be most effective. And for example, Pratchske concludes that there's now a broad consensus that this is the way to go about doing health promotion, for example. And Flanagan et al. Talk about, there's evidence of population-level outcomes for children and families through engaging multiple community systems and so on and so forth. And in the Hutchison and Russell study, community coalitions are described as having some positive effects on substance use. So there's a range of positions in terms of the systematic reviews, ranging from, for example, Stockings et al., who use a particularly sophisticated methodology to combine the findings of different studies and conclude that there's little impact, to Pratchske and so on, saying that there are significant associations. But it's really, so the question, if we were to simply stop here at the existing systematic reviews, we'd be forced to say, well, the jury is still largely out on place-based initiatives in the context of drug-related harms. So our aim is to integrate that and to hopefully take a little further step towards providing an evidence base in relation to this theme. It's obviously a difficult theme to study in terms of reviewing the literature, because the main terms are all used in a very varied fashion in the literature. Community-based can mean literally anything. Place and locality are, omnipresent terms. Nearly everything is targeted in some way. So it's quite difficult to actually identify studies. We started off with the idea that, behind this heterogeneity in the terms and concepts used, there could be quite similar initiatives in, for example, criminology and child development, local development, family support, drug-related harms, and young and educational supports. So we were expecting to find that initiatives that were coming from different sectors or subject areas would be perhaps converging on the outputs related to drug-related harms from different directions. So we were particularly concerned to try and identify those studies coming from different fields. So we used several bibliographical databases. I'm not going to go into much detail on this here, but simply to say we screened more than 40,000 records in order to identify 41 studies. Okay, so a ratio of roughly 1,000 to 1, which is obviously almost Herculean task, which we carried out with Julie Glanville and through the collaboration also of Peter Kelly, who's here somewhere. So through this great, enormous effort of screening and sifting through the literature, we identified these 41 studies. The studies, obviously with varying degree of coverage, but these studies cover the following place-based initiatives. So they cover Prosper, Communities That Care, the Icelandic Prevention Model, the Healing Community Study, and then smaller initiatives like Pulling Levers and SCORE, and there's an initiative in the Cherokee Nation, there's the Martinsburg initiative, and a couple of other programs in Barcelona, known as Saludas Bari. And these are all initiatives that can be described as place-based because they have those characteristics that I mentioned a little bit earlier. So they're involving the community, typically through the form of a local committee, like a community coalition, which is often nominated from the top down on the basis of who knows most, who's best placed, who's able to say something useful and interesting about this theme. Bringing together, for example, in the US context, bringing together the chief of police and faith leaders and people from the community and local businessmen and so on. In the European context, involving more of a kind of partnership between welfare professionals and local groups and citizens. But in all cases, seeking to activate local resources. So there's always an element of mobilizing local resources in order to tackle those problems. And they're based on the assumption that you can only understand and know those problems from the perspective of practice, from the perspective of lived experience and practice. So the grounding in a strong ownership by the local community is kind of constitutive of the place-based approach. And following on from this is obviously the idea that you need local data in order to select interventions which are appropriate in the local context in order to tackle those problems. Now, again, in terms of impacts, we have a lot of data and research on Prosper and CTC, which are the longest standing programs, and a lot less data on the more recent ones. For example, the largest of all is the Healthy Communities, the Healing Communities study, funded, I think it was mentioned this morning, I think Paul maybe mentioned, that there's not a whole lot of funding for interventions, and if it was effective. Well, here in the case of HCS, we have a really well-funded US intervention, funded to the tune of $350 million. So the kind of cutting edge in place-based initiatives are programs like this, explicitly designed to tackle the opiates epidemic in the United States. And there's a lot of interest being focused on place-based initiatives from that perspective. So how can you address a problem like the opiate epidemic? And the answer is through a coordinated and concerted intervention, which puts together the medically assisted therapy, which puts together wide distribution of naloxone and training in the community, and campaigns to reduce stigmatization and so on. All of this is happening simultaneously in the same areas. In terms of the impacts, there's considerable evidence on impacts in Prosper and CTC on the school students who are the main targets of those programs. And really in this kind of, let's say, the first generation of place-based initiatives of this type, they stay quite close to a more kind of classical prevention perspective. So they'd be intervening in schools with the students from maybe 12, 13 years of age upwards, and then they'll be holding programs which involve those students' parents and families, and maybe to a certain extent also community actors. So there's some evidence of impacts on in those groups when they're still school students, but in the studies from Prosper and CTC, after 8, 9 years, and when those young people are leaving school and moving on to study or employment, there are no longer identifiable impacts. Some of the other place-based initiatives, like the Icelandic prevention model, haven't really been subjected to rigorous assessment. Like CTC, IPM has been emulated in a number of countries. The kind of thinking, the logic underlying the Icelandic model is based specifically on supervising young people, directing them towards healthy leisure activities, and closing down basically the space where young people can socialize without supervision in the street or outside of the scope of those organized activities, even to the extent of imposing curfews and so on and so forth. The pulling levers and score are initiatives which are which are applied in the States, but particularly in disadvantaged Afro-American neighborhoods. And they're quite heavily oriented on a policing approach. So, for example, pulling levers involves, distinguishing between the hardened criminals involved in the drug trade and the petty dealers, and convincing the petty dealers to go into treatment and to do parenting courses, because if not, then the lever will be pulled and they'll be hit with the full force of the law. So that you have that kind of approach in the, let's say, the downtown areas in the States, whereas HCS and CTC would be more, they'd be applied in sort of Middle America and in more kind of white areas and in smallish towns, really. So there's a lot of heterogeneity in the programs. I think a lot rests on the evaluation of the Healing Community study, as I mentioned earlier, as the largest, with a lot of money also to evaluate the impact of that study. In overall terms, I think a lot more research is required in order to explore the mechanisms. I mean, it's a key issue. We all know, that we need a better understanding, and that understanding can really only come from an engagement with the practice community and with people with lived experience. And we need the understanding of the mechanisms, because place-based initiatives try to intervene in relation to the mechanisms as they're instantiated in a specific kind of context. And that means we need to understand the role of locality a lot better. And it's immediately apparent from these studies that, community means one thing in Iceland, and another thing in the States, and another thing in Ireland, and another thing in Holland, and so on. One of the studies on the implementation of CTC in the Netherlands showed how, for example, they had treatment area neighborhoods and control neighborhoods, and they were seeking to implement certain interventions in the treatment areas. But the professionals, like the social workers and the people working on the ground who were involved in the program, they said, oh, okay, this is an evidence-based program for prevention and so on, and it works, okay, and they looked at the evidence, and so they took it and then they applied it across the whole city. So the study was kind of sent into a short circuit by the sort of the contrasting logic of a more centralized approach to welfare. And all of these factors become enormously important. All of these differences become very important. Again, in the States, you have lots of local autonomy. You have the school principal will be answering to a local school board, and the mayor will be elected, and the chief of police will be elected, and this idea of the community through its stakeholders and the autonomy of the local community really has quite a different meaning compared to the European context. And it's obviously extremely important to tackle the legacy of disadvantage that, again, previous speakers highlighted and that you're all very aware of. We continue to return to this, but it's fundamentally important to stress, talking about mechanisms and talking about place, how entrenched and important the experience of disadvantage and discrimination and trauma is. And for example, one of the interesting aspects of the Martinsburg initiative relates specifically to adverse childhood experiences and trauma. So they're in that initiative, they're focusing much more on preparing people involved in service provision for dealing with trauma and adverse childhood experiences and so on. So they, for example, any children and families who are come into contact with the legal system are immediately flagged up as being potentially affected, and mechanisms are put in place to provide support. So there's the idea in that initiative that what a place-based initiative should really be doing is intervening to try and prevent intergenerational transmission of risk factors for problem substance use through tackling trauma and its effects, and looking both ways, both trauma as a precursor and trauma as an outcome of disadvantage, substance use, and discrimination. And we need also to think about synergies between programs, because it's obvious that we can't have a place-based initiative for everything and they would always just be stacked on top of each other. You'd have the place-based initiative for early school leaving and substance use and poor health and diet and sport and so on and so forth. So I think it makes sense to kind of see this, this paradigm as involving, on the one hand, a framework, and then on the other hand, a series of interventions. So I think that's one of the kind of messages that I think we can take away from this literature, that you can see place-based initiatives as having the structure of intense and ongoing community involvement and setting up structures for making interventions appropriate and accountable and so on. And involving also a process of innovation. The reason why you set up a community coalition is because you want to learn more and do things differently and to identify a new way and a more effective way of tackling the harms. And then within that framework, you can apply different kinds of interventions. So I think that's the paradigm behind the place-based initiatives. That's the interesting part, because it enables us to in some way distinguish between the way of working and then the specific kinds of interventions that are used. And all of this obviously set against the backdrop of ongoing research and monitoring, which again plays a key role here, because in that context of constant innovation and adapting the interventions to the local context without research, we're really working blind. So thank you for your attention, and looking forward to hearing any questions you have later.